Australia, in addition to our partner agency. Go any further as we begin this morning's formalities, can I... Good morning, everybody, once again. Our distinguished international consultants, Professor Ken Takahashi and Dr. Matthew Soberg, who I understand have come all the way from the University of Sydney in Australia. Welcome to Fiji. The Director, ILO Country Office for the Pacific, Mr. Dong Lien Lee. The World Health Organization Division of Pacific Technical Support, Dr. Muhammad Nasir. And it's good to meet Dr. Luisa, the Acting Deputy Secretary from the Ministry of Health. And I also recognize representatives of our tripartite partners from the worker side, from the employer side. And for all of you that have been able to be here, that are actually here for this workshop, representatives also from tertiary institutions that are here. And those from, ladies and gentlemen. Basically this morning, first thing I want to say, good morning to you all. Nice wet morning. Nice wet morning, but at least you're under shelter and you think you're going to they have nice warm coffee outside, so that should keep you stimulated. I think this kind of weather too is good for the brain. It stimulates us. So you'll need a lot of that. So I'm here, delighted to be here this morning to officiate at our first ever Fiji Symposium on asbestos. With the theme, I've been told, of equipping the workforce with the right knowledge about asbestos. So I'm sure that you, together with me, are looking forward to the outcomes and the outputs that you'll get from the 1.5 days that you'll be spending on this particular workshop. It's a time for you to share your experience, and it will be beneficial to all of you, your organizations, and especially for the people of our country into the future. I'm sure you're all looking forward to the input from the two experts that have come across from Australia to impart their knowledge, and I hope that you will make sure that you extract as much out of them as possible. So by the time they leave Fiji, as much as possible, you have been able to get information for us. Asbestos, as you well know, probably much better than I am aware of, that it is there are risks to do with asbestos for human health. In June of this year, we had an asbestos frenzy in Fiji, in Suva. It hit Suva town when a junior staff member of the Secretariat of the Pacific Regional Environment Program for SPREP circulated information in social media, information that should not have been circulated, that they should have had more control over in that organization, how they manage the information, how they manage their own staff. And because of that, despite the ministry issuing an assurance that the 30% asbestos containment was only on the materials, the physical materials in the Suva Civic Center that was tested, and that the asbestos was not airborne, unfortunately the damage was already done. Local media outlets and the social media sites, they went berserk. All kinds of rumors were spread. Some organizations in their civic center went as far as preparing to issue face masks to their workers and sending their workers home. Political parties started doing the same thing. So it became a political and media circus. Political parties exacerbated the situation. Some business actually closed down. So there was considerable unnecessary panic and productivity loss for the country as a whole because of this. I want to make sure that those kinds of things don't happen again. That asbestos is important, that we need to be able to manage, but one of the important things is the knowledge needs to get out there so people know what the situation is and that we can manage those things. I, as a minister, any issue on asbestos must be dealt with in a way that makes sure that we look after the lives of our citizens, but at the same time not to cause unnecessary productivity loss of the economy as a whole. So for all of you here, we must work together to ensure that any removal is dealt with properly, that all relevant stakeholders constructively consult to ensure that any outcome benefits all, and most importantly, protects the general public. I think that is absolutely essential. I hope that we don't see any repeat of the events that resulted in unnecessary and unwarranted public panic. Fiji is now looking to deliver on our newly released 5-year and 20-year development plans. And these plans, one of the key ingredients in it is always cooperation and collaboration. And that's the same sort of thing we need in anything to do with asbestos. It will require collaboration and cooperation and working together. That's absolutely essential. We have, in our country now, we have enjoyed around consecutive years of economic growth, about 8 years in total. We're looking to 10 years of consecutive economic growth. We've had a good drop in unemployment from 7.1% in 2010 to around 5.5% for the period of 2015 to 2016. But we know, and I know, that continued growth, one of the key ingredients is the quality of our workforce and the lives of the workforce and the health of the workforce that we have. Because everything that we do in our country depends on physical effort, mental effort, which in turn is dependent on the quality and the lives of the people in our country. So this morning, I want to acknowledge the continued support of the World Health Organization. Thank you very much for your continued support, and also for the ILO, International Labour Organization. We have forged a closer working relationship since we established our occupational health and safety profile that we launched at the World OHS Day. That was this year, was it not?
Yes.
Yes, that was this year. I'm getting old now. I'm forgetting the time. But I think that is an excellent. That again is an example of collaboration at the international level, at the local level. That is something that we need to continue to emulate. A working group or committee consisting of the World Health Organization and ILO personnel, together with staff from training institutions, the Ministry of Health and Medical Services, and staff from my ministry, have worked tirelessly to ensure that Fiji's national OHS profile was launched within the time frame I had initially requested. So to all of those that were part of that, I know you had some sleepless nights, but thank you for getting that work done. I'm happy to announce, that profile was then presented to the Occupational Health and Safety Advisory Board at its sitting in July. And I'm happy to announce today that the NOSHAB, or the National Occupational Health and Safety Advisory Board, not only endorsed the recommendations, but also appointed the tripartite representatives to the committee. And I believe that the tripartite representatives of the committee are also with us this morning. The National OHS Profile that has been launched provides a snapshot on Fiji in terms of OHS, in terms of our occupational safety and occupational health status and the opportunities, and it identifies the opportunities that we have to overcome our challenges as a developing nation. The profile also highlights recommendations for Fiji to work towards, in fulfilling the challenges identified. The advisory committee on Fiji's national OHS profile, I've been told, will be staying back from tomorrow for another 1.5 days to develop strategies towards fulfilling the profile's recommendations. So you'll have this workshop, and that committee will have further work to do. In terms of occupational health, this is very important for Fiji. And together with the other programs that we have that impact on our workforce. Major one, of course, is non-communicable disease that is just decimating our working population, or the people that contribute most to the productivity of our country. I am sure that you all agree with me that the occupational health component is a priority area that must be strengthened. Not just occupational health and not just occupational safety, which for a long time has been the focus of our ministry, but together now with the partnership of WHO and the ministry, occupational health, the health of the workers that we have, the health of our people. So I thank and acknowledge our international partners for their continued assistance in bringing the resource personnel that we have this morning, and for all the medical personnel, the health inspectors, and all the tripartite partners. I've been informed that this symposium is made possible through funding from the ILO with support. So thank you, ILO, for the support, and from the ministry and the National OHS Advisory Board for recognizing and endorsing these events under its 2017-2018 list of priority trainings and commitments. So for all of those parties, thank you. This Asbestos Symposium is targeted at equipping you all with the right knowledge about asbestos and with the critical need for Fiji to strengthen its capacity to identify, assess, and safely control or eliminate all asbestos or asbestos-containing materials. It is a reminder to us of our collective responsibilities as employers, employees, and stakeholders. Research has proven, I am told, that all forms of asbestos are hazardous to humans, and asbestos exposure is also responsible for certain diseases and occupational diseases. Fiji has a list of hazardous substances and usages that are subject to prohibition. Even though there is a regulation in place prohibiting the use of asbestos under specified purposes, there is a need to review this regulation so that we can be on par with international best practices. We need to constantly review our laws so that they are current, applicable, and relevant. That is the challenge that I put to you also as the relevant stakeholders, to propose the changes to practices and laws if these laws are outdated or if they need to be improved upon. The World Health Assembly resolution on cancer prevention urges member states to pay special attention to cancers for which avoidable exposure is a factor. The Assembly has also requested the World Health Organization to carry out a global campaign for the elimination of asbestos-related diseases. Eliminating asbestos-related disease is now a challenge for all countries, for our small Pacific Island countries, including Fiji, because we have a lot of old buildings around, some that might have been constructed 100 years ago or even beyond, and which could still have asbestos in them. My ministry is presently working closely with stakeholders, including other government ministries and non-governmental organizations, to identify these workplaces and buildings which may still contain any asbestos or asbestos-containing material and provide appropriate recommendations in line with international standards and international best practice on how to monitor the safe removal and disposal of this asbestos. The ministry has recently successfully assisted the Suva City Council with the safe removal and disposal of asbestos and asbestos-containing material that was present in the old Civic Center, and we can now see that the work is continuing on the renovation of the Civic Center. We are currently supervising and working with those involved in the asbestos removal works, which includes the safe removal of asbestos-containing materials from the Nosori market, the old Nosori market, not the new one, and also State House, where His Excellency the President resides in Suva. So those are two current projects that are currently being undertaken. We have experienced in the recent past that the work of the ministry is sometimes affected when organizations carry out misreporting and inappropriate presentation of critical information to the general public, as I've earlier highlighted. We hope that that will be catered for in the future. We are now working with stakeholders in our efforts to try and work towards the elimination of asbestos-related diseases by identifying all those buildings and properties that may contain any form of asbestos, including identification of suspected material, assessment, analysis, and recommendation of the correct removal and disposal process. Ministry intends to engage internationally recognized institutions to further train our OHS staff to upgrade their knowledge and skills so that they can be able to better conduct asbestos management in line with international approved standards. We have already placed in last weekend's dailies, the newspapers, notice for expression of interest, inviting asbestos training institutions and providers to provide this training. The ministry is of the view that one of the best ways to prevent or reduce asbestos-related disease is to work towards banning or minimizing the use of all types of asbestos. We will consult with relevant stakeholders to map out safer substitutes and developing economic and technological mechanisms to stimulate its replacements. The advisory committee will continue with their planning workshop, as I mentioned before, after this symposium, to map out the strategies towards fulfilling the recommendations highlighted in the OHS profile. I urge the committee to also consider the resolutions that might come out of this symposium and see how this can be integrated into its planning activities. So once again, I want to thank the tripartite partners, together with ILO and WHO, for supporting this initiative, for promoting dialogue and consensus on matters that will improve the safe and health in workplaces in Fiji, that will in turn have an impact on the productivity of our country. So do make use, all participants, make use of the presence of our consultants that are here. Make this a productive event so that it will help the advisory committee during the planning sessions to put together strategies that will be helpful in creating a safer and healthier workplaces in Fiji and in the Greater Pacific. I wish you all the very best for our first ever Asbestos Symposium, and my blessings for this forum to produce very fruitful sharing and learning experience, and I have much pleasure in opening this symposium. And before I sit down, I wish you all a very healthy, Merry Christmas and a very prosperous New Year in 2018. Thank you, Minawale Udanyabara. God bless.
This was one of the main issues dealt with. He spent 6 years in WHO as coordinator for health and environment. 6 months. Let's welcome
The occupational environment has been in Japan. I was
labor law reform, labor migration and mobility. Before he took researching occupational safety and safety management.
leaves, what they call it, for the roof.